today's conversation, you'll hear from myself, from David Freeze. In today's conversation, you'll hear from myself, from David Freeze, who is a bureau chief within the Division of Family and Community Services, Karina Lopez, who serves as the Associate Director of the Illinois Office of Welcoming Centers for Refugee and Immigrant Services, from Kylon, who leads is the Deputy Chief of the Office to Prevent and End Homelessness, who will present on information from our Office of Community and Positive Youth Development, and Mahmood, who is our New Arrivals Response Lead. So we will have a comprehensive presentation and excited for questions. So who we are is the Office to Prevent and End Homelessness. This is our vision and mission, and we really look at that no resident in our state lives on the street, in a shelter, or in overcrowded housing. And that we look to understand when a housing crisis occurs, that there's a safety net that can surround and support folks so that there's a quick resolution to housing and that people are stabilized in homes quickly. And the work of the State of Illinois Interagency Task Force and Community Advisory Council is to coordinate state agency strategy and investments around housing and housing security to build a strong safety net and permanent housing for all people facing homelessness and housing insecurity. Next slide, please. So if we look at the data year over year, your communities complete a point in time count. So go out in January and do a physical count of how many people that we see on the street, how many people are in shelter. So year over year, we started taking this data since 2005 so that we can see how numbers of homelessness have dropped. This data goes until 2020. We didn't do a complete count during COVID. And now those numbers have risen primarily due to the fact that new arrivals are also included in our homelessness counts. So in our 2023 data, you'll see a small increase from 2020. However, we're trending downwards. Where we aren't trending downwards is within those households who experience chronic homelessness. So that's for people who have a disability and for people who have longer periods of homelessness. So I think our work in understanding how to support people who experience chronic homelessness will continue as we haven't been able to make a dent in downward trajectory there. Next slide, please. So in 2022, we did a count to understand in Illinois, how many people do we know who experience homelessness? And there's about 44,000 individuals each year in the state who experience little homelessness, meaning they lived in the streets or lived in a shelter or someplace not meant for human habitation. The majority of people who experience homelessness in our state do not have a mental illness or substance use disorder. About 18% live with a mental illness, about 12% with a substance use disorder, about 5% are veterans, about 8% are fleeing domestic violence situations, 6% are young adults between the ages of 18 and 24, and 5% are young adults ages 18 to 24 who also are parenting. We also count about another 77,000 children who are identified as being homeless through our public schools. So in 2020 to 2021, there were about 77,000 children who met that definition. We know from our own data that we don't have enough shelters to support folks who are seeking shelter. So in our state fiscal year 22, we know that for the agencies that receive Illinois Department of Human Services funding, that there were 9,837 instances of turning folks away because there wasn't enough shelter, and instances of turning away 2,651 children for lack of shelter. So in our state fiscal year 23, we, through our initiative Home Illinois, were able to increase our shelter program from being a $10 million program to a $50 million program. We also know that if you could go back, please. We also know that the amount of time that it takes for households, once we've identified them, to actually access a permanent resource for housing is lengthy. So the average wait time in Chicago, for example, in which a person is identified needing a permanent housing resource, so not shelter, but a permanent housing resource, the wait time is about 2 years before that household is able to access a permanent housing resource. And those times it really varies by community. Next slide, please. We also know the deep racial disparities that exist within homelessness. So Black Illinoisans are about 14% of Illinois residents, about 30% of Illinoisans experiencing poverty, yet 61% of those experiencing homelessness. And our administration has created a racial equity roundtable on Black homelessness, where we brought together Black leaders from across the state and partnered with the University of Illinois in Chicago to do a deep analysis of what was at the root cause of this disparity. In April, we will anticipate releasing that report and to help us understand what it is that we can do at the state level and share this data with you at the community level about what this looks like. I think that we understand from the data is that Illinois has one of the worst Black-white disparities in homelessness in the country. We have some of the lowest rates of white homelessness in the country. It's Illinois and Mississippi at the bottom. And this disparity is second worst in the country behind New York State. So we have significant work to do as a state to reduce this disparity, but if we can do that, then we really understand how we are able to create a safety net that can serve all people, because we've been able to do that and understanding better with our very low rates of white homelessness. Next slide, please. So our plan to prevent and end homelessness is called Home Illinois. It's a 2-year plan, and it is for our state fiscal years 23 and 24. So it's actually our first plan activities closed at June. So we're currently working on our next plan. However, we will have the same framework. And our framework is looking at having racial equity at the core, and then 4 pillars. So the first pillar is around building more affordable and permanent supportive housing. We know permanent supportive housing is the gold standard for addressing chronic homelessness. Talked about addressing our chronic homelessness disparities, that we want to really work with local communities in ensuring that permanent supportive housing can be built. The next is around bolstering our safety net. So everything from prevention, how do we prevent households from becoming homeless, to shelter diversion, which supports people at the shelter door, to having enough shelter to support people when they are in crisis. Securing financial stability, so supporting people accessing quality jobs that can pay a living wage to afford market rate rent, or for those who are disabled and unable to work, ensuring that folks have access to the benefits that they're eligible for. And then closing the mortality gap. We know from national data that the average age of death for an individual experiencing chronic homelessness is in the early 50s. So we have extensive work to do to close that mortality gap. Slide, please. And we know that it's not just one intervention that will collectively end homelessness, but there's all different types of interventions, from diversion to prevention to shelter to access to affordable housing and some of the more intensive permanent housing resources. We know that if we invest heavily on the prevention end, that is the goal of the future. That some of our state plans and federal plans around homelessness have not focused enough around prevention, because we've been so focused on the crisis in front of us and having folks in shelter on the street. So prevention is something within the new federal plan to prevent and end homelessness, and what we want to focus on as we look to our next plan. Next slide, please. And one of the primary ways in which our funding is made available is through partnerships with our continuums of care. So in the state of Illinois, we have 19 continuums of care, COCs, which are community-wide policy and planning bodies around homelessness. So each community in our state has, as part of one of those 19 COCs, They are identified through authorization from the U.S. Department of Housing and Urban Development, HUD, and that they provide a function of preparing a joint funding application to HUD. And we utilize our continuums of care to help us on a number of partnerships, be that identifying service providers for some of our state funding, to launching pilots, to just working in partnership on strategy. And the continuum of care, the COC, is not just one agency. It is a whole host of agencies that make up a community. So it includes persons with lived experience, nonprofit homeless service providers, faith-based organizations, schools, universities, hospitals, even state government. So we will have, and local government. So there's wide representation, and includes their responsibilities include operating the homeless management information system, the data system, doing planning for the continuum, and helping to apply for state funds and federal funds. Next slide, please. So there are 19 COCs in our state. The left-hand slide shows where those COCs are located across the state. You can see in some continuums, if you look at, for example, the Northwestern COC includes multiple counties, but then right below it, the Home for All continuum includes 4 counties. And below that, the Sangamon County is one county for the COC. In Cook County, there are 2 continuums of care in the same county. So Chicago has 1 continuum, and then suburban Cook has its own continuum, which means that the data that is stored within the homeless management information system is all locally managed and owned. So we don't have statewide access to completely understanding what happens as far as data-wise goes. I think that we are working to understand that through our partners and data sharing agreements. And then the right-hand side will show how HUD identifies whether or not a continuum is considered rural, suburban, major city, or other largely urban COC, so a mix of urban and rural. So we have 1 major city COC in Chicago, suburban, but the vast majority of our state is a largely rural COC classification. Next slide, please. And this may be what it feels like in trying to identify and find where are resources for folks. That people have different entry points to accessing homeless services, that there are different providers, different ways in which things are coordinated. And part of our work is trying to understand how we move from this type of system to a more streamlined, coordinated one. Next slide, please. And one of the ways in which that's done is through coordinated entry. So when you're looking to understand how is it that your community has access to permanent housing for households experiencing homelessness, the bulk of that is provided through referrals from your coordinated entry system. So it's a centralized referral network that provides access to our permanent housing resources like permanent supportive housing and rapid rehousing. It allows communities to prioritize vulnerable populations to determine who receives those resources. And it's a way for communities to understand how folks who are the highest need actually can access resources. So before coordinated entry, we had homeless service housing providers would maintain their own wait list. And usually folks who had access to a case manager or who had the most abilities were able to get successfully on those wait lists. But folks who may live in encampments, aren't connected to services, may experience chronic homelessness or longer periods of homelessness, weren't able to get on those lists. So in order to create equity within the system, HUD moved communities to having one centralized wait list for housing, and to also reduce individual service providers from having their own separate criteria and not serving hardest to serve populations. And so, the coordinated entry system is one of the primary access points and ways in which homeless housing resources are accessed. So how you would get connected in Chicago, calling 311 and asking for short-term help can get you connected to shelter resources. Folks have to be literally homeless in order to access the bulk of these resources, meaning that they need to be in a shelter or on the street. So families who are doubled up are not going to have the same level of access. So calling 311 and then outside of Chicago, focusing on being able to access statewide 211 is a primary access point for homeless resources. Next slide, please. And the core elements that we understand case is around the triage, diversion, intake and assessment, and then moving folks, prioritization as I discussed, and then referring folks to the department. Next slide, please. Okay. I'm now going to hand it over to David Freeze, the Bureau Chief in the Division of Family and Community Services, who will spend time talking about the number of programs that address homelessness within that bureau. Thank you.
Hi, everyone. I'm going to talk about the homeless services, three main programs we have. The first one is emergency and transitional housing. Current funding for this fiscal year is $51.9 million. We also have homeless prevention program with funding of $21.8 million and a supportive housing program at $19.4 million. The emergency and transitional housing program is a comprehensive shelter program to help people who are at risk of homelessness or who are homeless. It provides funding for meals, shelter, and support services. The program has overnight shelter for people to stay overnight, and they have a transitional shelter with housing for up to 2 years. Also, we have motel and hotel vouchers that we give to people for short-term temporary housing stays. The program has accessibility to at least one meal each day and supportive services, which include housing location, inspection, placement, abuse intervention, job preparation and employment services, counseling, transportation, follow-up, and case management. The homeless prevention program is for people who are experiencing homelessness or are at imminent danger of eviction or foreclosure. Program is up to 6 months and provides short-term assistance to stabilize housing. The program consists of different services, including payment of rent or mortgage, rent or mortgage arrearages, utilities and utility arrearages, and also payment of security deposits. The program also provides supportive services directly related to prevention of homelessness, including housing location and inspection, legal services, job preparation and employment services, counseling, outreach, follow-up, and case management. Our third program, supportive housing program, is designed to help individuals who are formerly homeless or at risk of becoming homeless. The program is designed to help people with supportive services and to function independently. Most of the clients are housed in either single room occupancy type facilities or apartments and family developments, apartment buildings. And the supportive services are provided on site or clients are provided with transportation or referral to different services. They're tailored to meet the needs of people. And the people that we serve with this is some of them have to have like a disability or so it's a little more targeted towards specific population. Services include mental health services, alcohol and substance abuse counseling, job training and employment services, childcare, transportation, and advocacy. The next program is the Welcoming Centers. I think that's Karina Lopez I'd like to introduce.
Thank you, David. Good afternoon, everyone. My name is Karina Lopez. I am the new Associate Director for the Office of Welcoming Centers for Refugee and Immigrant Services. What I'm going to go over right now are the services that we have for our communities, for immigrant and refugee communities around for the state of Illinois. One of the things that I do want to mention is that our particular office is the main funder for different community-based organizations and for all the different programs that you're seeing in this slideshow. They provide vital document services to limited proficiency in English, and also for the immigrant refugee community. Part of the programs that we fund, it's the Immigrant Integration Services, Illinois Welcoming Centers, which is a one-stop services, which I will explain as we go into the deck, Refugee Resettlement Services, Access to Justice, which is legal services, Title 20, and legal aid services. Next page, please. Next slide. The Immigrant Integration Services, this particular program has 3 sub-programs underneath that. One of them is the Immigrant Family Resource Program. I do want to let everyone know that this program, 36 community-based organizations are part of the Immigrant Family Resource Program. So there is 36 organizations around the state of Illinois that they provide services to our communities, our immigrant and refugee communities. The purpose of this program is to raise awareness and improving access to public benefits. In addition to this, they also do conduct interpretation and translation for our benefits. They do outreach. And also they do assist individuals to apply for public benefits. As you might know, it can be a little bit difficult to navigate the system when it comes to enrolling into public benefits. The data that you see here about the people that have the unduplicated individuals served under this program, this data is from July 1st of 2023 through January 31st of 2024. Under this program, organizations have served 27,884 people, and these include individuals and also families. The third program that we have is the Immigrant Family Support. This particular program is to address the needs for vulnerable immigrant community members, especially those that have been impacted due to COVID because they didn't qualify for any type of unemployment. And under this program, this is a financial aid assistance for our immigrant and refugee community. And under this program, we have served around 11,524 individuals. The third program is the New Americans Initiative. This program focuses in the increase of rates for naturalization to be able to, for those that are legal permanent residents, for them to be able to naturalize. And the way that this program is pivotal is because organizations, 48 organizations that have this particular program, they do outreach. In addition to that, they also make sure that they provide the tools necessary for individuals to be able to get naturalized. As you might know, right, for you to pass your exam in some of the situations, you have to be able to be fluent in English language. So the organizations provide the educational component to ensure that the individual is prepared to make sure that they naturalize. In addition to this program, they also help individuals apply for renewing their DACA. And this program has served 5,094 individuals under the New Americans Initiative. And this has been between assisting individuals to naturalize and also helping individuals in applying for renewing their DACA. Next page. Illinois Welcoming Centers is a program that IDHS administered, technically my office, which is the Office of Welcoming Centers. We have 44 community-based organizations that are part of this program around the state of Illinois. This model is a one-stop center that provides linguistically and culturally services such as case management, crisis intervention, referral, outreach, and community alliance. So anybody that walks into any of our Illinois Welcoming Centers program, they will assist them with any type of case management. Under this program, we have served 17,875 individuals, and that also includes families. The other program that we collaborate together is the Refugee Resettlement Services. The Illinois Department of Human Services administers the Refugee Resettlement Services, but is in collaboration with a Jewish Federation. The way that this is set up is that we have around 8 different refugee resettlement agencies that provide services to refugees coming into the state of Illinois to assist them with the resettlement. This particular program is pretty unique because this program is only for refugees that are coming into the state of Illinois with the refugee status. Under this program, from July 1st through January 31st, we have the refugee resettlement agencies have resettled around 1,597 unduplicated individuals. This is individuals and also families that have come to the state of Illinois to be resettled. Next page. Access to justice, as I mentioned, is a legal services. There are 52 community-based organizations that are part of this program around the state of Illinois. Their main focus is to do deportation defense, also to ensure that legal representation in immigration and other civil and criminal proceedings, and provides legal assistance to immigrant and ex-offenders. Under the program, we do want to let you know that the organizations have served around 4,407 unduplicated individuals, and this can be also in screenings, legal screenings. Title 20 is another program that we have, is for low-income immigrants and refugees. The program also provides training to high-skilled refugees for certification and job placement. These services include training, job searching support, networking opportunities, and includes also employer education to address cultural issues and enhance networking. Next page. Oh, legal aid services. Legal aid services is another program that we have. We have 6 community-based organizations that are part of legal aid services. The purpose of this program is to expand the available immigration services and increase the number of immigrants receiving quality immigration legal support. Under this program, we have assisted 880 individuals at screening under the legal aid services. 735 individuals have completed and submitted applications for immigration remedies. And these immigration remedies can be T visas, asylum applications, TPS. And in addition to this, we have served 3,882 individuals that are participating in education and trainings. When we talk about education and trainings, these are trainings that organizations conduct when it comes to what are your rights, what type of legal remedies that you might potentially qualify. So one of the main trainings is Know Your Rights trainings.
Thank you, Associate Director Lopez. Good afternoon, everyone. My name is Kylon. I serve as the Deputy Chief in the Illinois Office to Prevent and End Homelessness. And today I'm supporting our colleagues in the Office of Community and Positive Youth Development, and we'll talk briefly about some of the program offerings there. And I will do that as soon as my slides would like to advance. I apologize. Okay. So the leadership of the Office of Positive Youth Development is served by the Bureau Chief, Kristen Marshall, the Associate Director, Carrie Ruder, Senior Public Service Administrator, Wendy Nussbaum, and Public Service Administrator, Julie Strimba. Homeless youth programs. The homeless youth programs serve young people who are aged 14 to 23 years of age, who cannot return to a home or have lack of housing and the life skills necessary to live independently. The program strives to meet the immediate safety and survival needs of young people, providing basic needs such as food, clothing, and shelter, and access to those supports. The program also ensures necessary service referrals to the comprehensive community-based youth services system by providing mental health support, substance use, and services for prenatal and parenting youth. Some additional services that are provided include emergency shelter and transitional living service provision. Services available to young people in these programs are to support basic needs, once again, such as access to housing, food, basic need goods, assistance in obtaining and maintaining available support services within communities. There are three major program components to positive youth services. Outreach, so outreach programs designed and designated to identify young people who are maybe experiencing unsheltered homelessness, being street-based, and addressing their basic safety and survival needs by conducting outreach going into communities. Emergency shelter, interim housing. So housing programs that provide temporary housing and services to young people experiencing homelessness on a 24-hour basis for up to 120 days. These programs, again, are designed to meet the basic safety and survival needs of young people experiencing homelessness and housing instability. And then transitional living programs. Transitional living programs provide housing and services to homeless young people for up to 24 months, so 2 years. And these programs are designed to transition young people from homelessness to self-sufficient living. Some additional services that are provided to young people. Housing and access to basic need goods, clothing, shoes, accessories, personal hygiene products, connection to services such as SSI, SSDI, WIC, and TANF, etc. Linkage to educational services and life skills, independent living skills, employment or vocational training, some additional recreational services, social skills building and training, homelessness prevention services, access to transportation, as well as individual counseling, services for special needs populations. So folks who may be pregnant and parenting, LEP folks, LGBTQ identified young folks, and unaccompanied youth. Also offered are parenting classes, prenatal care, nutritional education, and some access to legal services, substance use services, and mental health services. I want to pass along now to my colleague, Mahi, who will talk about the new arrivals response team.
Great, thanks so much, Kylon. Hi everyone, my name is Mahi. I'm the Refugee and Asylee Resettlement Lead at IDHS, primarily working on our mission to welcome new arrivals with dignity to the state of Illinois. Next slide, please. As we jump into this section of the presentation, I'm going to move fairly quickly so that just in the interest of time, but want to start with a little bit of level setting and happy to answer any questions at the end. So want to start with an acknowledgement that the response to the new arrivals mission has been led by the state via the Illinois Department of Human Services in partnership with Illinois Emergency Management Agency and support from a whole host of other state agencies and community partners. Some of the guiding principles that we have used in order to guide our response to this effort has been around providing a welcoming and dignified reception to new arrivals and really promoting resiliency for self-advanced independence, ensuring people's safety, and being a good shepherd of state resources while still providing equity in our response and centering equity as we think about the resources available to new arrivals as well as to the broader population of people experiencing homelessness. Next slide. Just want to start with a little bit of context before we jump into the state's response. As you all likely know, in August of 2022, the state of Illinois began receiving buses of new arrivals and asylum seekers from the state of Texas. In response to this, there was an enactment of the disaster proclamation by Governor Pritzker, And while the disaster proclamation focuses largely on the new arrivals arriving by bus from Texas, we have a host of other services that are available generally to the immigrant population more broadly, a lot of which we already heard about today, so I'm not going to spend much time on them. Next slide, please. When we think about what our response to the new arrival mission has been, we began in September of 2022 with the state standing up hotels for families in partnership with the city, who was responsible at that point for sheltering singles. This slide has some key metrics that we've pulled out from that time period, from September 2022 to August 2023. You'll find that one of the things that we enacted during that time and invested in is wraparound services. So as you can see, there are over 24 community-based organizations on site at these hotels. They assisted with school enrollment and education access to public benefits, etc., and case management services more broadly. That investment in wraparound services is what allowed us to decompress those hotels by August 2023, at which point the state, city, and county shifted to a more strengths-based approach. Next slide, please. That strengths-based approach meant essentially that the state would be leading the charge when it came to wraparound services, the city would be leading as it related to shelter, and the county would be leading on all things related to medical services. On the next few slides, what you'll see is a list of some of the primary investments that the state has made in FY24, in addition to the about $100 million that was invested in fiscal year 23. So one of the first bullets on this slide is related to ASRAP, which is the Asylum Seeker Emergency Rental Assistance Program. This is something that likely many of the folks on this call have heard about. It is a rental assistance program that allows people to find permanent housing supports and has been a very successful way of resettling people that were previously in the shelter system. Additional resettlement supports include support from Catholic Charities and New Life to both resettle folks, divert folks from shelter, and out-migrate folks in situations where they have family or friends that can provide housing and support to them. We also want to recognize ICER, which is a key partner for the state in terms of case management services. Next slide, please. Again, there's a lot on this slide because there are a lot of roles that the state is playing to support these individuals, but a couple of the key things that I'll call out here are donations coordination that has been done by New Life Centers to provide essential needs items to new arrivals. Many folks are arriving to Chicago, especially in the wintertime, without coats or proper winter gear. Those are donations items that are provided at that point. We have also stood up an intake center that is co-located with the City of Chicago's landing zone at the Maxwell Street Market location, which is allowing us to have a more coordinated effort to have folks entering the Chicago shelter system. And then finally, and more recently, there has been a hotel that has been stood up by the state in order to support measles quarantine with the ongoing response. Lastly, on this slide, I want to give a big shout out to MMC, which has been a key partner in the SMAS administration. SMAS is the supporting municipalities in assisting asylum seekers program, which allows municipalities from across the state of Illinois to put up their hand and say that they want to support the new arrivals mission while still receiving funding from the state to support that work. So thank you all. Thank you to MMC for their support, and thank you all for putting up your hand and supporting this mission. With that, happy to answer any questions on things that I didn't give voice over to, but I'll hand it over to Chief Haley to close us out.